All Children Thrive California, known as ACT, is an exciting initiative dedicated to creating opportunities that support the well-being of all youth. ACT brings together community members, youth, city officials, and community-serving organizations who work side by side to create innovative approaches and policies to strengthen the capacity of mental health, housing, early childhood, and youth development services so that all children and youth can thrive. The process of ACT is to move us from our current state, where few children thrive, through the transformation process and into a new transforming future where all children thrive. Part of the reason few children thrive in the current state is because there are forces driving inequality. If wellness were a building, in the current state, it would be best described as a tall skyscraper with a fence around it. The few children that can get inside can easily take the elevator to the top floor, but the fence keeps most children out. The fence represents forces such as capitalism, classism, racism, trauma, and isolation. In the current state, the decisions are made by few people. Kids outside of the fence are vulnerable because they don't have protection or a safety net. They live with constant uncertainty that children and families inside the fence rarely experience. Communities outside the fence are essential, but many times are not valued or heard. One of the greatest strengths of the community that exists outside the fence is that they have experienced a lot together and are the true experts where they live. They also love and care for one another in ways that are often overlooked. The first phase of the transformation process is to bring together community members, youth, city leaders, and community-serving organizations who work together to identify leading factors contributing to childhood and community trauma and design how they would like their community to address these needs. For example, a youth center with wraparound services, comprehensive approach to COVID-19, or a mental health crisis response team. This group is known as the design team. In ACT, the design team works together to develop a shared vision and purpose and facilitate a community-led assessment to identify city priorities and strategies for creating healthy, safe, and strong communities where all children and youth can thrive. In the second phase of the transformation process, design teams participate in learning networks, bringing together people from many different backgrounds who are interested in working on similar topics. ACT and key partners work together to provide technical assistance to execute the strategies selected in the community-led assessment. The learning networks will be organized around community action areas, which are a collection of strategies and activities focused on promoting healthy child development, creating protective environments, youth development and civic engagement, strengthening economic supports for children and families, and access to safe and stable housing. During the third phase of the process, there will be rapid sharing of results in real time through the learning networks. ACT will help cities collect and analyze data in a way that identifies strengths, successes, and improvements using data dashboards. While issues like the COVID pandemic and racism have created real challenges in communities and for youth, there is an opportunity to address these challenges and reimagine the future for our youth. Instead of a small group with privilege making all of the decisions will be made by many people, including neighbors, parents, youth, and as a result, the communities are redesigned to ensure that all children can thrive. This will result in healing, which may take many forms, such as affordable housing, alternatives to criminalization, investment in early childhood learning, loving adults and mentors, safe spaces for youth and families, as well as youth-centered activities.